Good afternoon. I'm Dr. Sandra Martell, and joined with me today is Mayor Tom McNamara from the City of Rockford. Today, all schools in Winnebago are back in session providing both in-person and remote education. Most schools have reported cases, but there is a difference between cases in the school amongst staff, students, and teachers, and transmission in the school, in which cases in schools are epidemiologically linked, meaning they're passed from classmate to classmate, or teacher to student, or student to teacher, bus driver to student. We've not seen that in our schools. So it becomes important to understand the difference when I hear and get questions every day about what's going on in the school. We hear there are cases in the school. We hear there are contacts in the school. Yes, you're going to hear that. But at present, those cases have been acquired in the community and not in the schools. So we continue to work with the schools to do contact tracing through a case investigation, understanding in that particular scenario, if it's a student, what the student's day is like, where they go to class, where they sit in the room, what kinds of activities they are involved in, are they wearing their masks, who's their lunch buddy, how do they get to school? And then we also, if it's a teacher or a staff member, what is it that they do all day? What is their role in the school and the educational system? How are they involved and engaged with the students? So we can clearly identify who's a close contact and quarantine those individuals. So understand there's a difference between cases in the school and transmission in the school. School metrics, one of the questions I get asked is, as we've been in, South Beloit now is in week 4. Rockford and Harlem, our two biggest districts, are in week 2. And then we've got a lot of schools in between that time frame. Is yes, we look at test positivity rate in our schools, and I should say in our community. We want it to be less than or equal to 5%. New cases per 100,000, we want that to be less than 50 per 100,000. We want new cases to either be decreasing or stable. And cases among youth will be particularly focused on. We want to make sure that those are either stable or decreasing. And I think we had talked about this last week, but the Illinois Department of Public Health is now posting county-level metrics for schools on their website. And so I encourage everyone to take a look and see what our county's metrics are in terms of schools. But remember, when we look at schools, we look at individual communities and what is going on in that particular school environment. So unlike what we did in March, where we might have the whole entire school system shut down, we are going to be very tactical and strategic in looking at the transmission in the school, the number of cases that may be acquired in the community around that, so that one school within a district may have a very different response than another school. And our entire county may have very different responses, whether I'm in South Beloit, Harlem, Rockford Public, or Winnebago. Students and teachers, staff, who report or exhibit one or more symptoms of COVID-19 are excluded from in-person learning. I've heard a lot of that going around, like, why am I being sent out of the classroom, or why can't my child attend school? Because we are locking down tight on those school environments. And the reason for that is we cannot afford to have transmission in the schools if we are committed to in-person learning. So I remind everyone, if you have any one or more symptoms and you are working in a school environment or you're a student in that school environment, you will be sent home. We cannot have you in that environment. So while schools have worked diligently and rearranged to prevent transmission inside the school, cases to date have acquired infections outside of the school. We have had a lot of transmission related to Labor Day weekend activities, parties, family gatherings, traveling teams, and sports. So while schools work very hard every day to keep infection rates down within their walls, we need you, the community, and our parents to work on those outside activities. And we need to be intentional and thoughtful if we want to keep our schools inside. We need to make those conscious choices for our kids and our community. We need to wear our face coverings and masks. We need to maintain social distancing. And here's a big one. Limit gatherings with family members from outside of the state or friends with whom you have not cohorted. I think that's a message that maybe has not gotten out there enough, because just because they're family doesn't mean that you're inherently protected from them. We've had visitors from out of state coming to stay with family over the Labor Day weekend. College kids returning, we talked about that. And that exposes the students in the younger grades who then go into the classroom, or if you're a teacher, you may be bringing the infection into the schools. So again, wear the face coverings, be intentional about your contacts, wash your hands, and stay home if you have one or more symptoms. Because if you are identified and you self-certify, we are also going to be sending you home from those environments. So I know that that's very disruptive to parents. You may be called to pick up your child at school because they're exhibiting one of the symptoms. And until we can rule out that it's COVID-19, we have to make sure that we protect the inside of that school environment. So as we've said before, take it outside as much as you can. Enjoy our remaining warm summery days that we have here in the northern part of the state, and stay local. But do your part to keep our kids safe outside so that they can stay inside at school. So some of the things, I know we talk about everything you can't do, but we are going to really be working on some guidance about what can you do, how to do it safely during a pandemic. So right now we're working on guidance related to the apple orchards, pumpkin farms, and festivals that are coming up that make our area so vibrant. Of course, I've had a lot of calls about Halloween, trick-or-treating, or haunted houses. We can have these kinds of activities, but we're going to have to do them differently if we want to make them safe for our children. And of course, we're going to be approaching family gatherings and holiday celebrations. And so that becomes important to understand what that means and how we can keep our families as safe as possible. And of course, as December approaches, the Santa visits. So we really have to be thoughtful about this because we are in a pandemic. It has not gone away. We're going to have to learn to live and coexist with it in the safest way possible. And we are planning for population vaccination. And so I've heard it used the term mass vaccination. I want you to think about population vaccination because I'm not going to bring people into mass to get vaccinated. We have partnered with the University of Illinois College of Pharmacy to provide leadership on this planning. We have been meeting over the past 6 weeks to review background information and planning assumptions. And of course, we are learning information just as you are about the different vaccine trials, what this vaccine may look like, how many doses will it take, how far apart do they have to be administered, how are we going to get it to everybody, who's our priority populations. And our goal is to have that plan developed by October 31st. Again, throughout this, we'll be sharing with the community on a separate media briefing by the team in the coming weeks so that we can go through and poke holes at the plan so the community is aware of how we're planning to introduce and roll out this vaccine. Because again, as we take a look at it, we need the population and our community to trust that we are planning with the best guidance available to us, and that the trust that you've provided throughout the pandemic in the health department and its partners, we need that continued trust as we look at a vaccine. Enforcement. We announced our enforcement before the Labor Day weekend. As we went through this, complaints of violation of the executive order continue to be reported and logged to the COVID-19 hotline. Code enforcement officers have been making site visits to the location, as we've said before, to provide education and guidance and establish a corrective action plan. And to date, there have been 3 entities issued a notice of noncompliance. Berean Baptist School in Rockford, Illinois, CJ's Lounge in Rockford, Illinois, and Tony's of Winnebago in Winnebago, Illinois. These entities will be posted on the website, and they've been issued official notices of noncompliance with a portion of the executive order. We have made a commitment to our community and to our business partners that we will work through this enforcement process. And again, we will keep that posted. It's available on the website, and we encourage our community to take a look and really work with those businesses to get them into compliance, because the complaints are generated by you as the community. So while we can enforce and we will work them through that process, we also need to be using our collective influence on these businesses and entities as they move forward. So today, the number of new cases being reported are 40, and those ages are anywhere from 2 years to 68. This brings our total to 4,794 cases. But concerning to me is our growing positivity rate. We are reporting a positivity rate of 6.8%. And remember, we are trying to keep below that 7%. So we need to double down on our prevention efforts. We have no additional deaths to report. Our recovery rate is still at 96%. And some good news to demonstrate how things can get done is the following locations have completed 2 or more incubation periods without new cases, meaning that they have worked within those institutions to stop the spread. East Bank, Milestone on Greenwood Avenue, Present St. Anne, and the Atrium. So thanks to the staff in those institutions and the family members of those that they are cared for in those settings, they have worked very hard to keep those infection rates down. Now we have to do our role as the community, keep the infection rates outside low.